Hey guys, and welcome back to the third video of Unit 9. We're still looking at blood. Last time we ended off talking about blood type, and I kind of got rushed towards the end. I didn't get a chance to talk too much about Rh factor. Now, Rh factor is, of course, the factor in the blood that's going to give you that positive or negative that comes after your blood type. It comes again by another antigen that's on the surface of the red blood cells. This time we call it the rhesus factor, Rh for short. Rh positive blood has that antigen on the surface. Rh negative blood does not. Okay, so it's similar to the ABO, except this is a different factor called Rh. Now, Rh can have a role to play certainly in how we transfuse blood, give blood to different patients, but it can also cause problems with a mother and a baby if she's pregnant. And we'll talk about that real quick. And if there is that problem, the disease is called the hemolytic disease of the newborn, or HDN. And this is what happens. In the case of a mother who's got a first pregnancy, and if you get a difference in the Rh factor, so in this case, the mother is Rh negative and the baby is Rh positive. During birth, there's probably going to be some blood exchange between the mother and the newborn, apart from placenta, outside of the placenta. So what will happen is the blood from the baby will get into the circulatory system of the mother. Now, the mother's body is going to treat that as an invading pathogen, right? Because it's not part of the mother's body. So what will happen is we'll get our immune cells. They'll come alive, they'll launch an attack, and they'll create antibodies, and that's what those little Y-shaped things are. Antibodies against that Rh antigen that we see on the blood surface. Okay, so now after that pregnancy, after the mother's given birth, she's going to have those antibodies that are going to live in her body for a long time, maybe the rest of her life. The problem arises when we get into a second pregnancy. So if the baby has, again, the Rh factor is different than the mother, so again, the second pregnancy, the baby is Rh positive and the mother is Rh negative, the mother is already going to have those antibodies in her system. So what will happen is those antibodies could end up in with the fetus. And then that fetus has antibodies that will attack the antigens on the surface of its red blood cells. And that's called a hemolytic disease of the newborn. And as a result of that, what could happen is the newborn's blood cell count could be way down because the antibodies are destroying the red blood cells. So this is something that we can treat medically, but it needs to be carefully monitored by the doctor. Okay, let's move on to talk about blood transfusions. Now, for the rest of this section in Unit 9, the end of the section of blood, so for the next probably 10 slides, there's a lot of extra information on these slides that I don't expect you guys to know, but it's there to help you understand, okay? I'm not going to test you directly on a lot of this stuff, but having that background knowledge will help you understand the big ideas that we are trying to teach. So keep that in mind as we go through and pay attention to what I'm explaining more so than what is on the slides, okay? So that should be what you should focus on for the the rest of this video. So whole blood transfusions are what we used to do all the time. And what we would do this is if there was an extreme loss of blood, so if somebody was cut and they had a massive hemorrhage, from a serious injury, if they had really bad internal bleeding, or if they had surgery, we would use whole blood transfusions. And now we're talking about whole blood, we're talking about giving cells as well as plasma, okay? So the whole composition of the blood, that would be a whole blood transfusion. That's generally not the way it's done. Generally what we do is we focus on more specific things depending on what that patient needs. So what we generally do is when you give a blood sample, for example, it'll go into a centrifuge. Now, if you're not familiar with a centrifuge, it's a machine that takes a whole bunch of little jars and it rotates them at high speed. And depending on what speed or how long you rotate them, you can separate different pieces of a fluid out based on their weight. So, for example, if we spin something really quickly, we can get the blood cells, because they're heavier, to move to the bottom of that jar. Then we can take the plasma out, and we can have the plasma and the cells. There's two words that we use to describe when we're trying to separate blood components. One is hemapheresis. Now, and what hemapheresis is we'll take a sample of blood out from a donor, we'll spin it and keep the elements, which are going to be the cells. And then we will return the plasma and everything else back to the donor. So we basically just take the cells from the body. And that's going to be a process called hemapheresis. Now, if we just want to take the plasma, then the word we use for that is plasmapheresis. So we take a sample of blood, spin it, we put the cells back, and we keep the plasma to give to somebody else. So hemapheresis and plasmapheresis is just two processes that we use in order to separate the blood components. Another type of blood transfusion, this one's more common, is packed red blood cells. So we use packed red blood cells, and that's the most common transfusion we use today. We take a blood sample from a donor, we spin it so that we just get the red blood cells, and we can keep these red blood cells in the fridge for 42 days. So it's good for almost a month and a half. And that's why you get calls every now and then for, oh, we need blood of this type because we've run out of that type of blood. So if you're using packed red blood cells, you need to think about what the patient is getting. And in this case, they're just getting the cells, okay? Anything that's going to be in the plasma, so for example, antibodies, platelets, proteins, any electrolytes, anything at all in the plasma is not going to be passed on to the patient. It's just going to be the red blood cells. Now, even though antibodies aren't generally passed on because they're in the plasma, not the cells, some of them do get passed on, but generally not enough to cause a major reaction in the patient. Donation of plasma has become really popular, and if you've been following COVID during the progression of the disease, one of the most promising treatments we had early on was a plasma donation from people who had COVID and recovered. So we do plasma not just as medical treatments, we do it for a lot of reasons, including replace blood volume. So if for some reason you've lost blood and you need extra volume to maintain proper circulation, we'll do that. We can use it to treat shock when you have a failure in the circulatory system. If there's plasma protein deficiencies, if you need to replace clotting factors, if we need antibodies, whatever is present in the plasma, we can use plasma treatment to fix that in another patient. It was a promising treatment for COVID patients. I'm sure it's still being used, but I haven't heard any information about it recently. Now, we'll talk about some blood disorders for the next little part of this slide. There's a lot of conditions listed here, and I'm going to talk you through them so that I kind of make it a little bit less confusing for you. Okay, there's three main blood abnormalities that we'll talk about. Okay, the first one is anemia. Now, anemia is when there's low level of hemoglobin or red blood cells. Okay, so those conditions, and there's a lot of different types of anemia. Those are anemic or anemia conditions, is when red blood cells or hemoglobin is low. The next abnormality is leukemia. Now, leukemia is an increase in white cells. So we talked about how many white cells are normal in the blood count. And if we get above those normal values, then what we've done is we've got some type of abnormality, and that we group into a group called leukemia. And finally, we get clotting disorders. And this is when the patient has an abnormal tendency to bleed. So they've been injured and the blood continues to flow. It doesn't clot, and we don't get that hemostasis that we would expect at a given time. So 3 of those blood disorders, make sure you know what these are and what the differences are between them. Now, what I'm going to suggest to you guys is the definition of anemia. And here is 6 or 7 different cases of how we can have different forms of anemia. Okay, what I would suggest to you guys is you don't need to study all of these, but I would know probably 2 types of anemia and how they're caused. All right, so you can focus on this table, have a look down through it, and make sure you know the definition of anemia, and then find out 2 different types and know what causes them. Okay. And we'll do that for a lot of the groups here when we're talking about blood disorders. The next blood disorder, of course, is leukemia, and that's going to be when we get a dramatic increase in the white cells. Now, there's a couple of different ways that we can categorize leukemia. It can be acute, which means it is sudden. or it can be chronic, which means that it lasts, for a long time. So the acute one is quite quick, and the chronic one is long or long term. So we classify them either as acute leukemia or chronic leukemia, or we can also classify them as myelogenous, which means that the leukemia is caused as a result of the bone marrow, or it can be lymphocytic, sorry. And that means the leukemia is caused from the lymphoid tissue. So if we come down here and we look at the bottom of this slide, we get acute lymphomatic leukemia, acute myelogenous leukemia. So we're talking about a short or quick onset leukemia. In this case, it comes from the lymphatic tissue. In this case, it comes from the bone marrow. Okay, so make sure you know acute and chronic, and myelogenous and lymphocytic. And the third disorder was the clotting disorders. Now, the clotting disorders are different types of coagulation disorders. So the blood doesn't clot, or it doesn't coagulate like it should. And this is caused by some problem in that coagulation process that we talked about, the hemostasis problem. You can see there's 4 different kinds of clotting disorders here. Hemophilia is probably the most commonly talked about one because it's a genetic cause, and you often see it travel down through families. So it's often quite widely discussed. Again, for you guys, I would just focus on 2 different types of clotting disorders and not worry about 2 other ones. Okay, that will help you move it along a bit quicker. Now, some common laboratory blood tests. I'm going to move through this pretty quickly, but I'm just going to inform you about some of the things we can do and some information we can gather when we collect a blood sample. The first thing that doctors will almost always prescribe is a complete blood count. So when we're doing a complete blood count, we'll look at everything that's cellular. So red blood cells, white blood cells, platelets. We'll also look at the hemoglobin value. We'll look at hematocrit, and we'll look at a differential white blood cell. Now, what a differential white blood cell is going to be is we're going to look at the number of types. So in a video just before, we talked about the different types of white blood cells. Well, we're going to find out how many of each one of those blood types are going to be there. That's a differential white blood cell count. So don't worry about the ranges for these values. I just want you to understand the definition, okay? So we measure the hematocrit, which is a measure of red blood cells per 100 milliliters of whole blood. So we're basically measuring how much red blood cells are present in a patient at a given time. And that can tell us a few things. So here's an example of a hematocrit test. This is going to be a normal test. We've got 45% red blood cells and the rest is plasma. Anemia, that's when we have low blood cells. So we talked about that before. So we only see like, around 30% red blood cells compared to normal sample. Polycythemia is what happens when we get extra red blood cells for some reason, and this can be bad because it can lead to clots, a lot of other issues. So this is obviously something we worry about. And then in this case, this is dehydration. Again, we've got the same amount of cells that we'd see in polycythemia, around 60%, but you notice the plasma level is way down. So this patient needs to get water and needs to get fluids really quickly. Another thing is hemoglobin. So we measure hemoglobin by a process called electrophoresis. If you've ever seen a DNA type test where you see the little bands that show up on a test, that's the type of electrophoresis. And what we're measuring is the grams of hemoglobin per 100 milliliters of whole blood. And hemoglobin will give you an idea if there's any anemia present in the patient. We'll have red blood cell counts. So we talked about the different normal ranges of blood cells, red, white, and platelets. We'll also look at blood smears, which are going to be we'll be able to see the physical cells. So we'll be able to see the shape of the red blood cells, the platelets, the white blood cells. We'll be able to tell if there are any parasites present. These things would actually show up physically in the blood. There's this whole series of blood chemistry tests that we can run. Any changes up or down of these different elements or molecules will let us know the health of the patient. We also do